Welcome to On the Beat, everyone. I'm Troy Thompson. I'm joined with Amanda Fondren of Omnis Health Clinic, and today we're talking all about bioidentical hormone optimization. And I want everyone to know this is not just for women, it's for men too. Welcome to the show.
Thank you.
I think it's super important. I love this conversation because the reason why is, number one, men feel that, oh, there's nothing wrong with my hormones. Okay, I'm perfectly fine. It's you. You're the issue. But I want everyone to understand, and if you can explain to this throughout the segment, that sometimes it's not because you're feeling older, this isn't an issue just for older men. It can be as young as 26, 27 that you have hormone issues. Now, what is bioidentical hormones? Explain that to everyone at home. And are they different for men and women?
So bioidentical hormones are hormones that are derived from natural plants that are chemically structured identically to the hormones that your body produces versus synthetic hormones, which have a different compound look.
I understand.
To them.
Why is it so important for our body to be producing these hormones?
Hormones are necessary for every cellular activity. Our cells in our body that do metabolic processes on the inside of the cells use hormones of different sorts, not just androgens or sex hormones, but they use thyroid hormone and adrenal gland hormone, lots of different types of hormones. And when you optimize hormones, it helps those cellular processes for proper metabolic activity.
Yeah, and that's what I want to get into now. What are some of the symptoms that we would be experiencing at home, men and women, if our hormone levels are very low?
Okay. Men, of course, we're talking about sex hormones here, so men would experience low sex drive, decreased libido, decreased sexual function, but they could also experience fatigue, lack of motivation, foggy brain symptoms.
And men won't go and check it out. They don't know why. Do you know what I mean? They just put it down to I'm tired or I'm exhausted.
And they just don't feel good.
Yeah. All right. Is it the same for women?
Yes, and women and men alike can also experience decreased bone density as they age.
Really?
Yes, which puts them into risk for osteoporosis and fractures.
All right, very quickly, I want to ask you, how does one find out if their hormone levels are so low?
Well, they would need an evaluation.
I should say.
Right, they would need an evaluation in the
for?
clinic. I look at a lot of different lab levels.
Right.
I also look at symptom history, how far back symptoms occurred. And we base the dosing of hormones on all of those factors.
Now, this is blood tests?
There are blood tests.
Okay, perfect. Now, I want to talk to you about the pellets.
Okay.
Because the pellets are quite an extraordinary conversation to have. And I had these conversations about pellets when they first started being used, and more of an open conversation. Because people were having them and going, don't tell anyone. Do you know what I mean? Because it was a taboo topic.
Oh.
People didn't want to talk about it, that their hormones were low.
Okay.
So what is a pellet injection?
So a pellet procedure is a small instrument is used after a patient is numbed up in their fatty tissue on the back of their hip, and a small tiny incision is made, and this instrument is inserted into the fatty tissue, and it's like a straw kind of, and you place the pellets into a little opening in the straw, and you use a blunt thing a tool to push them up into the fatty tissue.
How long do they last before they need to be replaced?
In men, they last 6 months. In women, 3.
You're amazing. We want to talk more about this, okay?
Okay.
All right, we appreciate you. If you want to find out more information, there it all is up on the screen for you. I've been talking to founder Amanda Fondren of Omnis Health Clinic. Back after this short break.